Welcome to McPlum, simple solutions served daily.
In this video, I will explain how to take an upper premolar X-ray. First, ensure your patient is seated comfortably and upright, with their head straight. This foundational step is crucial for accurate imaging. Next, select a size 2 film or sensor. This size provides the best coverage for the premolar region. Finally, confirm the patient's occlusal plane is perfectly parallel to the floor, setting the stage for a clear and precise radiograph. Now, let's focus on film or sensor placement. Gently position the film with its long axis vertically within the patient's mouth. It's important to center the film precisely over both the first and second upper premolars to capture the entire area of interest. Make sure the superior border extends approximately 1/8 of an inch beyond the incisal or occlusal edges, ensuring all relevant anatomy is included in your image. Achieving the correct angulation is key for a diagnostic image. For the upper premolars, set your vertical angulation to a positive 30 to 40 degrees. This helps prevent superimposition. Next, direct the central X-ray beam precisely through the contact points between the teeth, minimizing overlap. Finally, ensure your horizontal angulation is perpendicular to the film, which is essential for an accurate representation of the interproximal spaces. For the final steps, ensure the X-ray cone is positioned as close as possible to the patient's face, without touching, to minimize distortion. Then, activate the exposure button, holding it down for the appropriate preset duration. Once the image is processed, take a moment to carefully review it. Check for diagnostic quality, clarity, and ensure all necessary anatomical structures are clearly visible, confirming a successful radiograph.
Thanks for watching. Stay juicy and subscribe.